This video will provide information about surgical removal of a segment of the colon, known as colectomy. The colon is about 3 to 5 feet long and is connected to the rectum and anus. Together, the colon and rectum make up the large bowel. This video will explain what to expect before, during, and after colectomy. It will not cover the numerous reasons why colon resections are recommended. Talk to your surgeon if you have questions about why surgery has been advised. Our group of office coordinators, nurses, physician assistants, nurse practitioners, and surgeons will help in any way we can to make this process less stressful for you. Preparing for surgery can be overwhelming. You are not alone. We appreciate the concerns and questions you will have throughout the course of your treatment. Just like athletes prepare for sporting events, you as a patient can prepare for surgery by exercising and eating a healthy diet. You should continue your current exercise routine, or if you don't exercise, now is the time to start walking around your neighborhood and improving your diet. Eating a well-balanced, high-protein, low-fiber diet and exercising before surgery will help speed up your recovery time afterward. Your surgeon's office will schedule the operation and go over with you what needs to be done beforehand. If necessary, the office will request and obtain pre-certification for the surgery from your insurance carrier. They will also tell you about the blood and other tests that need to be done 1 to 2 weeks before the operation. Most patients will also be asked to obtain medical clearance from their primary medical doctor and, in some cases, from a specialist. You will be scheduled for pre-surgical testing before your surgery. Here you will meet a provider who will go over your medical and surgical history, discuss which medications to take before your operation, and draw your lab work. 1 day before the surgery, you will be instructed to limit your oral intake to fluids and to begin a bowel preparation in order to clean out the colon. You will take antibiotic pills and a bowel preparation the day before your operation as prescribed by your surgeon. The bowel preparation and antibiotics decrease the risk of wound infection. Most patients do the bowel prep at home and go into the hospital on the day of their surgery. After your bowel preparation, you are allowed to, and should, continue to drink clear liquids until 2 hours before your surgery. Your surgeon may advise you to drink a particular sports drink or a high-carbohydrate beverage 2 hours before your surgery. Going into the surgery well hydrated facilitates the surgery and a more rapid recovery. Also, you will most likely be given some special soap or skin disinfectant to clean your abdomen before going to the hospital. This is also thought to decrease the chances of an infection. We have everything you need at the hospital, but some patients prefer to bring their own clothes and a comfortable pair of walking shoes or non-slip slippers. Please bring an ID, insurance card, and updated list of your current home medications with you on the day of surgery. You do not need to bring the actual medication bottles unless instructed by your surgeon. We ask that you leave anything of value at home. When you arrive at the hospital, you will go to the same-day admission area where you will be registered, interviewed by a nurse and anesthesiologist, and will speak to your surgeon who will obtain your consent for the procedure. You will also be given several non-narcotic pain pills to take before the surgery. You will then be taken to the operating room and asked to lie down on the OR table. An IV, intravenous line, will be placed, and shortly after, you will go to sleep.